This is the Lone Crater YouTube. We hope this video helps.
You begin by verifying the prescription details for Dr. X100 and why this matters. Correct strength prevents under- or overdosing. Once confirmed, inspect the tablet and expiration date and wash your hands to avoid contamination. Make sure you have 120 to 240 ml of water ready. This helps the tablet move through the esophagus. Read the label now for food or interaction notes, because taking it with or without food changes absorption and side effect risk. You place the Dr. X100 tablet on your tongue and sit upright. This position reduces reflux risk and improves swallowing. Take a full 120 to 240 ml of water, then swallow in one smooth motion. Do not chew unless instructed, because formulation alters release. Once done, follow the exact timing on your prescription, taking doses at consistent intervals to maintain steady levels. Make sure to check whether food affects absorption. It can speed up or slow action, so adjust reliably. You finish by logging the dose and any symptoms. Tracking prevents accidental double dosing and helps your clinician. If you missed a dose, consult the label. Often you take it within a few hours, otherwise skip and resume the schedule. Do not double up. If you can't swallow the tablet, experience severe allergic signs, or have persistent vomiting, seek urgent medical advice because alternative formulations or interventions may be needed. One key tip: if nausea prevents ingestion, contact your provider before changing the tablet form.
Thanks for watching. Consider subscribing if we helped you.